Hello everyone, welcome back to the channel. So today is going to be a little bit of different kind of video, and we have asked a special guest to come and talk to us and share his experience basically while studying abroad. So I'll just start directly with the introduction. Please introduce yourself.
Good afternoon, everyone. I am Dr. Viraj Narvekar. I'm from Maharashtra.
Okay. So, Dr. Viraj, from which university you completed your MBBS? From which university and country, basically?
I have completed my MBBS from Tver State Medical University from Russia.
Okay. Yeah. So, this is a very frequent question among students ki which country they should go for. So related to this, I want to ask you ki why did you go for Russia or like Tver University itself? What were the reasons behind it?
Back in 2015, when it was my decision to choose Russia, my first thought was that Russia had strong allies with India. This was my first point for selecting Russia as a country. And why I chose Tver was, my first preference was I want to stay in university which is close to Moscow. Like Moscow is the capital of Russia, and I will always prefer staying nearby to capital of any country. So, and the university is also budget friendly, plus all the perks we get by living near the capital. This was my main reason.
Okay, that's nice. Because of course, this is a really important factor for students who are thinking to go abroad. They get actually most of the students they in fact want to go to the capital city itself. But since most of the universities in the capital city are really expensive, तो वो थोड़ा सा difficult हो जाता है. But I think Tver makes it a good option since it is very near to the Moscow capital city and all of that. So I wanted to ask, have you cleared your FMG exam? When you cleared it, and have you started your internship?
Regarding that, I have completed my FMG examination in December 2022. And I'm right now currently doing watch duties in ACE Hospital, which is situated in Pune. And my internship will start by end of this month, or most probably by 15th of next month.
Okay.
Yeah, I've already applied for the registration in Maharashtra Medical Council. Yeah.
Okay. तो एक्चुअली वाई आई वांटेड टू आस्क यू दिस इज क्योंकि ये भी एक काफ़ी मेजर कंसर्न रहता है. यू नो दिस योर सेल्फ.
आई कैन
अंडरस्टैंड में भी ये चीज़ रहती है
yes.
कि how we are going to qualify the exam or clear the exam. So I just wanted to ask you regarding that as well. How was your experience overall with the FMG exam, and do you think it is really that difficult जो कि mind में लोगों के है? Although FMG is not going to be there anymore, most probably by the next year there is going to be like NEXT exam, but still there will be a lot of similarities in both of them. So what is your opinion about the overall exam? And
according to me, I feel right guidance is more important to appear for this exam. If you get right guidance, the seniors will guide you to prepare from start, which subject to do beforehand, and which subject to keep for the last, and how to prepare for the exam. If you get proper guidance, I don't think that it is that difficult. But see, exam is exam. You have to prepare for exam. You have to give your 100%. So if you are not going to plan your day, or if you're not going to study that well, then every exam is going to be difficult for you. Rather it be FMG or any exam, you name it. You have to prepare, you have to give your 100%. And if you're going to give your 100%, I don't think it is that difficult.
Okay. So yeah, because this is true, because the thing is कि ये काफ़ी है mind में लोगों के because of the low overall passing percentage and all of that. I also say this regularly कि if you are consistent enough with your studies, so it is not really that much of a difficult thing. एंड स्पेशली मतलब काफ़ी सारे स्टूडेंट्स के माइंड में ना ये चीज़ भी रहती है कि उस पर्टिकुलर यूनिवर्सिटी में आपको FMG कोचिंग मिलती है या NEXT कोचिंग मिलती है एंड ऑल ऑफ दैट. तो वो चीज़ों को लेके लॉट ऑफ स्टूडेंट्स दे समटाइम्स मेक अ डिसीजन. वो कोई एक पर्टिकुलर यूनिवर्सिटी है जिनने जस्ट अभी स्टार्ट किया है मे बी स्टूडेंट्स को पढ़ाना, और फॉर स्टूडेंट्स को लेट्स से उनका इनटेक अभी स्टार्ट हुआ है 1 साल 2 साल पहले, बट टू ट्राइंग फॉर प्रमोटिंग दैट पर्टिकुलर यूनिवर्सिटी, व्हाट दे विल डू इज़ कि हमारे यहाँ पे तो कोचिंग मिलेगी आपको एंड ये वो ऑल ऑफ दैट. तो आई ऑलवेज से दिस कि रेदर देन इन की फोकसिंग ऑन द कोचिंग एस्पेक्ट इन द यूनिवर्सिटी, क्योंकि वो 10 दिन 15 दिन आके आपको पढ़ा के जाएंगे मोस्टली. That of course it might help you, that might give you some idea कि कैसे start करना है कैसे पढ़ना है, but ultimately you have to do it yourself. And best way I think for it is कि आप in your starting years से ही आप अपना basically कोई online subscription वगैरह लेके start करो.
See,
right?
my advice on this is, I'm not saying that it won't help you, but see, exam is yours and you have to prepare for that exam. Any teacher from any part of country will come max to max for 15 days and it won't help you in any possible way. He can make you explain, like he can explain you topics, but you have to study them, you have to revise them, and that depends on you. See, you'll go to class, you'll sit in the classes for 15 days, you'll study everything. But what if you don't revise them? What if you don't study that concept again and again? See, if you study the subject in second year, you won't remember it for 6 years. You have to keep touching that subject again and again so that you can retain that part. So I feel revision and consistency, like you said, is the key for this exam.
That's true. That's true. So my next question for you would be about the NMC rules and regulations. तो वो एक काफ़ी बड़ा major concern है among students who are thinking to go abroad as of now. Of course, when we went to Russia at that time इतने सारे rules and regulations नहीं थे. We didn't even they did not even made it mandatory to qualify the PMT or NEET or all of that. तो कोई भी चला जाता था. In fact, if you had bio in your 11th 12th, so but still I think you must be aware about the rules and MC rules. So like, can you tell me, is the university like the infrastructure in Tver University and overall the teachers, the faculties, are they capable to fulfill all those criteria and all of that?
See, infrastructure is the best, because what in India you get only access to your hospital which is affiliated to your college. But in Tver or in Russia, I would say that this is your college and you get access to every other hospital in your city. Like you can practice in every other hospital. And regarding teachers, I feel, see, what happens, first 3 years it was completely in university. You have to go to university, study there, okay, pre-clinicals. And then after third year, like 4th year, 5th year, 6th year, what you do is, your teacher is going to be a doctor himself. You have to visit to the hospital where he will be practicing. You'll go there, he will teach you as a teacher during daytime. Like there will be a class for almost 4 hours in morning, and after that he will take you to see the patients. Like the way we can say that in India we have internship, right, for just for 1 year. But the benefit of studying in Russia is you get this for 3 years. Like every day you will visit hospital. The teacher will be your doctor itself, and then every day you will see the patients. Every day you have to go to the hospital. I feel this is the most special part about Russia, that you are going to visit hospitals for 3 years.
Yeah.
So you can imagine the amount of clinical exposure you are going to get.
Yeah, I also say this, that क्योंकि काफ़ी people have this concern कि you will not get clinical exposure and all of that. So I think actually Russian universities, they provide you ample opportunities कि you will get quite good exposure. But the thing is, most of the Indian students, I would say कि they don't really use it very well at most of the time, because जितने भी universities and they offer students to work in the summer time as well, in the summer vacation. So वो सब चीज़ें भी आपको मिलती हैं. Although you will not be, of course, working as a doctor over there, you'll be maybe working as a nurse assistant or something like that. But लेकिन still you will be getting exposure. वो बोलने के लिए title उसका अलग होगा.
Yes.
हाँ, तो that is something that of course हाँ, this is also true कि there won't be as many or like as similar diseases as in India that you will see on regular basis. तो लेकिन वो तो आप इंडिया में भी आपको once you start your internship you will do it in India also. तो I think that is something that is taken care of in the internship part in India. So I wanted to ask about medium of instruction क्योंकि of course जो NMC के rules and regulations are according to that the university should teach in completely full English medium. So I know that initially at our time when you started in the university back in 2015 around that time, so it was not completely full English university. So but I think by the time you guys graduated they had officially made it English, or maybe a year after that if I'm not wrong. So in past 2-3 years they are teaching in English if I'm not wrong. So can you give an idea like how was your experience since they did not had the official full English title on them, but still how was your class like experience with the classes and exams and all of that?
When we took admission, it was clearly mentioned that the university is bilingual. First 3 years in English, next 3 years in Russian. So the difficult part was when you have to study and prepare for exam in Russian, you have to translate the part, the concept which you want to study, first in English and then back again in Russian, so that you will be able to write papers. So, but the most difficult part was the process was very lengthy. Content is going to be the same, may it be English or any other language. It is going to be same. Just the difficult part was the process is lengthy, because first you have to make yourself understand all these things in Russian, in English, and then again in Russian, so that you can answer your teachers about any question if they ask
about the same thing in English.
But now that the NMC has complied to make the course full in English, so I feel now they have started the course, 6 years English course. And
I guess they have done it since past 3 years, I would say, almost around 3 years. So
I heard about it. Yes. And I feel that's great. That's very great, because the whole lengthy process is cut short down now. You can study and now you can start preparing for next right from Russian, because now you don't have to study in Russian or any other language. You can prepare for your university exams, plus the same content is going to be asked in next. So it is going to be beneficial for you in every possible way.
Yes, of course. Okay. So like since every student they are taught Russian language almost since the first day they arrive in Russia. You start your Russian language classes. So this is also a concern कि आप कितना सीख पाते हैं कितना नहीं, and how students can manage in their clinical rotations or internship part of thing. So can you share your experience with the clinical rotations and in hospitals and all of that?
For this question, I have a very great example. Consider if you are a Maharashtrian student living in Pune or living in Satara, okay, and you don't know any other language other than Marathi, Hindi and English, okay, and consider that you get admission in Karnataka or any South Indian city, and if you go there, your course will be in English, right? But the patient you will see in hospitals, will they know your local language? No, they'll speaking in their local language, right? So if you go there, then you have to learn little bit of their language. Same it is for us. If you are going to some other country, your course will be in Russian, but you have to know little bit of their language too, so that you can treat patient, right?
Yes.
So I think that learning bit of Russian, so that you can live their culture and get to know about them, and you can treat them. So I don't think it is much of a problem. It is doable.
Okay.
And
So
the classes,
classes.
the classes they give you for this language are very good. Teachers are so great that they'll teach you right from basics, like the way we learn ABC from in junior KG. The same way they'll teach you the language. So I don't feel there's any problem in learning a new language. Plus that language will remain with you for your lifetime.
Yes, of course. And I think the issue is arises from basically the mindset of students themselves. Ki if you will think of it as a burden on you, तो हाँ आप उसको interest भी नहीं लोगे कभी, and you will not be able to learn it. I won't say कि हाँ most of the medical students they are or they become extremely fluent in the language, but I think कि we know sufficient of it कि we can manage each and everything. So of course we won't be able to write literature with it, but it is enough for day-to-day daily conversations and hospitals rounds and all of that.
Yeah.
So can you give an idea like what are the differences that you felt as compared to education system and the class pattern and exams and all of that in India versus in Russia, since you are also now starting to work in the hospital, so you had some experience in of doing that in Russia and as well as now in India. So can you give some idea about that?
See, in India, what we get is we have classes which strength is 200 students in the same class. In Russia, that part was sorted out. So 200 students were divided in small groups so that every student can get individual attention from the teacher itself. See, in my course, there were around 250 students, but 250 students were divided in 15 groups, in 15 students per group, like that kind of way, so that every student would get attention from teacher. And what happens in India is the classroom will be such big hall that we have to sit with 250 other students, and then I don't feel we will get the personal attention from teacher as much as you get in Russia. Like this is the main difference. Plus the clinical exposure, consider it as anatomy subject. When they teach you on cadaver, there will be only 15 students surrounding that cadaver, right? But in India, there will be whole class, at least 100 students. So tell me, is it possible for you to get every other information what teacher is teaching you on that cadaver in a group of 100? Or is it possible, is it very easy for you to be there and get every information in group of 15 students? So this is the biggest difference I feel. And this will help you a lot. Like studying in small groups. Yes?
No, continue. I was saying that a lot of people think that in Russian universities you don't really get cadavers as well. Like mostly you will be working with robotic bodies or like dummies and models and all of that.
During my time, we also had this cadaver. We people named it as Anton. Okay, because the most common name in Russia is Anton, so we named that cadaver as Anton.
Yes, I remember. Yes.
Yeah. No, that's
we used to joke about it.
Yeah.
So we do get cadavers. You do get cadavers.
Of course.
Okay. So my next question would be like, did you face any kind of racism over there? Because some people, of course, since you're going away from home, and a lot of students, like when we went to Russia, we were just 12th pass students, and first time going away from the home. First time going away from the home and from family and all of that. So sometimes these kind of thoughts, they can scare people and scare students ki agar aisa hua to how will we handle things and all of that. So like, how was your overall experience with the local people over there in the city and in the country?
For 6 years I have lived there. I have never ever experienced any such thing. See, if the old lady in the bus will not get seat, she'll get grumpy. But that is not racism, okay? Even if in India, if an old lady will not get seat, she will poke you. But I don't feel that is racism. So if you start counting such things in racism, then it is very difficult. But I don't feel that. I have never ever faced any such things in Russia.
Yeah, that's true. Actually, I also say this ki, of course, you will find certain bad elements everywhere in every country and every place. So, of course, there will always be some exceptions. But if you talk about generally, so I also never faced anything like that. Ki, koi bad experience raho. Even we have traveled to so many different cities and places. So not in just our city where we used to spend most of the time, but even in other regions of the country, we never faced any such issues basically. Hello.
Hello? Yes, sir.
Yeah, I thought I lost
No,
you.
no.
Okay.
I was hearing throughout.
Okay. So about visiting different places. So can you tell me, like, have you visited different other cities and places in Russia? Because once someone is thinking about going abroad, तो वो
Yeah,
चीज़
of
में
course
might
we will
not be
explore.
है that we'll travel and explore.
See, best part of living in Tver was uh, between Moscow and St. Petersburg. And these are two major cities I will suggest everyone traveling to Russia to visit. See, because if you go towards Moscow, you will see the modernized part of the country. And then if you go towards St. Petersburg, you will feel it has touch of Europe. So I would suggest visit both the cities, and I have been there. Truly mesmerizing cities.
Okay, that's
And
great.
even other
Cute.
than cities, you can go outskirts. Like some people from my universities have traveled 2,000 kilometers in Russia, and they have like their experience were amazing. So you can explore.
Yeah, I've heard stories of students, traveling to
Yeah.
different. Even when I was in Altai, so we had a place around. It was around 400 kilometers away from our city, Barnaul. So it is kind of like hilly area. So it is called Gorni Altai. So we used to go over there in like almost whenever we could get time. Mostly during the summer days or summer times, in like summer vacation, near to the summer vacation. So it is like when first time I went there twice. When I was over there in the university. So first time when I went there, so a lot of people, they were just surprised to see foreigners in that far region of the Russia, and they were like, wow, they are like you could feel them, see them like that हैरानी वाला वो
That
उनके अंदर था कि
expression
ये
on their
कहाँ से आ
faces,
गए.
that
Yeah, that expression on their face कि ये कहाँ से आ गए. So although and of course when we went and talked to them, they were all of them were really happy to talk, and once we tell them कि India से है तो they become always happy and then start talking about movies and
yeah.
films. तो वो तो
No,
regular relation
I
again.
have met many Russians who have watched Indian movies, old Indian movie. You won't believe everyone, like most of the Russians know Amitabh Bachchan, Shah Rukh Khan, and they'll ask you about them.
Okay, so like just a few more questions.
Yeah, for sure.
तो थिंग इज कि काफ़ी सारे स्टूडेंट्स और पेरेंट्स को भी कई बार ऐसा लगता है, या काफ़ी एक मिस इन्फॉर्मेशन है, मुझे ऐसा लगता है पर्सनली, regarding studying abroad, studying MBBS abroad, कि it is not at par with what you study in India basically, or in an Indian college. So like what are your thoughts about it?
No, I feel ऐसा कुछ भी नहीं है. Like right now I am working in Ace Hospital and I've completed my FMG examination. No one has ever questioned me anything over there, that why have you completed your studies in Russia and why not India? Because once you clear your licensing examination, you are one and the same. Like no one can judge you, no one can question you that why did you not study from India?
तो एंड ऑफ कोर्स एंड आई थिंक कि एक ये भी रहता है, काफ़ी लोग सोचते हैं कि ना यू विल नॉट बी एबल टू गेट जॉब इन अ गवर्नमेंट हॉस्पिटल और समथिंग
No,
लाइक
no,
दैट
no, no,
आफ्टर
no.
कमिंग फ्रॉम अब्रॉड. So this is also misconception.
No, there are many seniors of mine who are working as CMO on RMO in government hospitals. So I don't think this is a right way to think.
Okay, so I think this is clear.
Yeah,
If,
very true, very clear. Because
for
right
everyone who
now
is
I
watching.
can, you can get government job easily, so you don't have to worry about it. And no one is going to question your degree or any such thing.
Okay, that's great.
Yeah.
So I think we talked about a lot of different things. Still, if you guys have any questions or doubts regarding studying in Russia, or in fact studying in State Medical University, you can comment them down, and Dr. Viraj will also go through the comments occasionally, and he will also help us, give answer to all of them. And of course, I'll also be replying to your questions and comments. So one last question for you: can you mm, would you like to give a message, any message to the students who are thinking about, or who are considering studying MBBS from abroad?
My message for you guys is, if you're thinking of going abroad, the best thing you're going to experience is different culture other than India. Plus, you're going to, if you don't get admission in government colleges in India, I feel then going abroad, studying in Russia is the best option you have got, because you're going to save lots and lots of money of your parents. The money which they have hard earned, like they have worked so hard for that money. So I feel that you can experience new culture, plus you're going to save money, plus you're going to be independent. All these are perks of studying abroad. So why don't you take a chance and study there? And this is going to be a great experience.
Of course, I say this almost every time when I touch upon this topic. It is not just going to give you a degree. Overall, going abroad is going to also give you a lot of different experiences and exposure, जो कि आपको इंडिया में रह के you will be never able to gain that much experience and exposure. And not just exposure in terms of just new culture, I would say exposure and experience in terms of friendships and relationships, everything. Like you will get to know a lot of different things, जो भी आपको मुझे लगता है कि इंडिया रह के a lot of people, they maybe of course you will get these experiences, but maybe they will learn them maybe 4 5 years later than us guys who have been abroad, because away being say away from the family and the friends that we had at that time, it is going to be a life-changing event overall. I think that's it. Thank you for talking to us, and I hope this would be helpful for some of our students who are thinking about going abroad. So thank you for watching. I hope you got a lot of your doubts cleared. And again, if you are new to the channel, so please subscribe and help us grow. And if you have any doubts or questions, you can always comment down, and we'll be happy to give you answers over there. So yeah, thank you, Viraj, Dr. Viraj, and talk to you later.